bronchopulmonary segments. You know, in the lung, we will have bronchopulmonary segments which are aerated by tertiary bronchus. What is tertiary bronchus? You know, there is a trachea which is dividing into principal bronchus, and that principal bronchus is 1 degree bronchus. So this is trachea, yes, and trachea is dividing into 1 degree bronchus, principal bronchus, yes, and then principal bronchus itself will divide into 2nd degree bronchus, which are also called lobar bronchus because they are going into upper lobe and the lower lobe of the lung. So you are telling that there is trachea which is bifurcating into principal bronchus, which is 1st degree bronchus, yes, and then it is dividing into 2nd degree bronchus, which are lower bronchus, yes. What are they doing? You see, this is upper lobe, middle lobe, and lower lobe for the right lung. And what about the left lung? Left lung has only 2 lobes. There is upper lobe and the lower lobe. Oh, so lobar bronchus. Then what is the lobar bronchus doing? This lobar bronchus is further going to divide into tertiary bronchus. And what the tertiary bronchus, 3rd degree bronchus will do? Tertiary, which is the 3rd degree bronchus, will be actually aerating 1 BPS. That is 1 BPS. Oh, that is 1 BPS. Yes, that is the point here. Understand, bronchopulmonary segments are aerated by tertiary bronchus, 3rd degree bronchus. So trachea bifurcating into primary bronchus 1 degree for each lung, right, left lung, yes. And then 1st degree bronchus, principal bronchus is dividing into some secondary bronchus, which is 2nd degree bronchus for the lobes, yes. And then the secondary bronchus dividing into tertiary bronchus, which is for the BPS, yes. Each BPS is supplied by tertiary bronchus. This is the definition. So how many BPS you have on the right lung? Right lung we have 10 BPS. And how many left lung is having? Actually 8 to 10 BPS. Now if you say right lung is having 10 BPS and left lung is having 8 to 10 BPS. Why? Because some of the bronchi may be combined. So if some of the bronchi may be combined, then what are the details? That details we will find out. But at this moment, this is a question asking some BPS segments. So what about this question? This present year, yes, present year 2013, it has come. What is it asking? It is asking for marker D. Let us magnify the diagram. So as you magnify the diagram, you want to see the D? Yes. I think there is some ABC here. Yeah, ABC, which is going within the BPS. But D is at the margin. D is at the margin. Now, if you're telling that one BPS is having some 3 structure, but some structures are at the margin. Remember, the structure which is marker D, which they have shown at the margin here, you can see, this is the structure they are talking about, the D. In the lungs, this is called as the pulmonary vein branches, because pulmonary vein branches are intersegmental in nature. Intersegmental in nature. Intersegmental in nature means they are between the segments. They are in the surgical planes. A surgeon is supposed to follow some surgical planes to minimize bleeding when they are doing segmental resection in the lung. You mean to say they can remove one BPS from the other BPS? Yes, you can do segmental resection, but you have to follow the intersegmental plane, which is surgical plane, decided by this vein, branch of the pulmonary vein here, branch of the pulmonary vein here. So what are these then? They are, of course, artery, vein, and the bronchus. Which bronchus? Tertiary bronchus. And which artery vein? You know, this BPS requires some oxygen and some blood must be taken back also. So what is all this? Let us find out. You see here, these veins are intersegmental, intersegmental, and intersegmental. Who is that? It is the pulmonary veins in the branches given in the intersegmental plane. So you are telling that this is going to be some surgical plane. Surgeons can follow and remove one segment from other segment from other segment, segmental resection. Yes, that was the question. They're asking about this vein, and this vein, this vein. So what is inside the BPS then? Directly going inside is tertiary bronchus. We have discussed third degree bronchus. And along with that, what is there? Is artery and vein. So as you are talking about see here, you will find that there is, the lung is having dual circulation. We already know. The lung has dual circulation. One is for the oxygen supply to the lung, which is basically bronchial artery will supply. And the other circulation is some deoxygenated blood coming to lung for getting oxygenated. So who is carrying oxygenated blood to the lung? The oxygenated blood to the lung was carried by bronchial artery. And who was carrying the deoxygenated blood to the lung? That is the branches of pulmonary artery. So pulmonary artery bring the deoxygenated blood. Yes, that is C here. You will find that pulmonary artery is shown in blue color. But why the branch of the pulmonary artery is shown in blue color? Because I just told you, pulmonary artery is bringing the deoxygenated blood into the lung so that in the alveolus it can be oxygenated. That is the job. So what is this tertiary bronchus bringing? Oxygen into the alveolus. So tertiary bronchus brings the oxygen into lungs. Yes, alveolus. And that is where there is some exchange of blood. This blue color which you are showing is pulmonary artery branch. Yes, it brings the oxygen blood. But what about the bronchial artery? Bronchial artery will bring oxygenated blood to supply lung tissue itself. So you are telling that bronchial artery will be red in color. Yes, the branches of bronchial artery will be red in color because that is the oxygen which is brought to the lung. Because lung itself requires oxygen beyond the level of alveolus. Alveolus will have oxygen, no problem. But beyond the level of alveolus, you need oxygen to survive. Lung has to survive, so it needs oxygen. That is carried by bronchial artery. So these are the details which we wanted to know. You can draw your diagram now. But this question was asking marker D, and you have already answered. Marker D was intersegmental in nature, and that intersegmental in nature is the segmental branch of the pulmonary veins. We are going to talk more about the lungs. Look at the lungs from the front view. You will see that this is the right lung. It is having 3 lobes. There is a superior, middle, and inferior lobe. And left lung has only 2 lobes, superior and inferior. This is the heart which is encroaching towards the left lung there. So you are telling that there is some horizontal fissure in the right lung? Yes, there is one oblique fissure also. And where is that oblique fissure? That is actually not very clearly shown here, but there will be oblique also. So oblique fissure here on the left lung also. Yeah, oblique fissure on the left lung also. But then you will see that there is no horizontal fissure on the left lung. So horizontal fissure is only in the right lung. Yes. And it also has the oblique fissure. Yes. What is between the horizontal and oblique fissure? That is the middle lobe. Middle lobe. Now if you say this is the middle lobe, fine. Do you have a middle lobe in the left lung? No, left lung is actually only 2 lobes, that is upper lobe and lower lobe. So this diagram is not very clear. We have to see one more diagram and then it will be evident. See, this is what we are telling, that there is a horizontal fissure in the right lung and there is one oblique fissure also in the right lung, so that bounded by the 2 fissure is the middle lobe. If you say bounded by the 2 fissure is the middle lobe, then There is a superior lobe, inferior lobe also. Yeah, that is there. What about the left lung? If you say left lung, then left lung has only one fissure, which is the oblique fissure, and that is why there are only two lobes. There is one upper lobe and there is one lower lobe. Now, once you have known the lobes, you have to discuss the BPS also. Let us talk about the bronchopulmonary segments as well. This is the front view of the right lung, and this is what we will draw. And then we will talk about the BPS also. So there is one horizontal fissure now. Yes, that is the horizontal fissure. And there is oblique fissure now. Yes, that is the oblique fissure. This is what we are going to draw. As you draw, this is the horizontal fissure, which is present only in the right lung. This is the oblique fissure, which is present in both the lungs, maybe right, left lung. And this is the lobe, which is the middle lobe, which is present only in the right lung. Then there is a right upper lobe, and then there is a right lower lobe as well. And this is the diagram which we are supposed to draw. But before you draw this diagram, you will understand that there are differences between the right lung and left lung. So what are the differences between right and left lung? Actually, I told you, right lung has 10 BPS and left lung can have 8 to 10. So it can be variable. And what is the other difference? The right lung is larger and heavier comparatively with the left lung, and it is some other features you can just have a look, but not coming as questions, so don't bother much. But there are 3 lobes in the right lung and there are 2 lobes in the left lung. Yeah, that is there. And there are 2 fissures in the right lung and 1 fissure in the left lung. Yeah, that is what we have discussed already. So let us continue with the details. You will find that we are now drawing the right lung anterior view. So when you are drawing the right lung anterior view, let us look at the tracheal bifurcation, which we have already seen as well. You see, this is the right principal bronchus, right main bronchus, and then you have the left principal bronchus. That is a first degree division. You see, there is a difference between the two, that right principal bronchus is short length and it has a wide lumen and it is more vertical. So there is more chances of foreign bodies coming to the right lung. That is to be understood. So you're telling that right principal bronchus is short length and wide lumen and more vertical. Yeah, that is why most of the foreign bodies will prefer coming to the right lung. Also see the difference angle between the two. The right principal bronchus, left principal bronchus, the angle is 70 degree. Then you will see that the right principal bronchus is divided into 3. What is that? That is the lobar bronchus, upper lobe, middle lobe and lower lobe. Whereas the left lung has only upper and lower lobe. You mean to say second degree division? Yes, that is lobar bronchus, upper lobe and lower lobe. Whereas on the right lung you have upper lobe, middle lobe and lower lobe. Second degree bronchus, secondary bronchus. You will see the right lung, which is having one apical BPS and one anterior BPS, one posterior BPS. This is right upper lobe. And then you will find that there is a medial BPS and a lateral BPS. This is right middle lobe. So you're telling that there is some right upper lobe having 3 BPS. Yes. And right middle lobe having 2 BPS. Yes. And then right lower lobe having 5 BPS. Yeah, 5 BPS, and the 5 BPS are named as apical BPS and 4 basal. 1 apical and 4 basal. And what are the name of the 4 basal? I cannot see 1 basal. Why? Because it is hidden. So 4 basal, but 1 basal is hidden. Yes. Okay, so this is the diagram which we are supposed to draw. Yeah. Right upper lobe having 3 BPS, right middle lobe having 2 BPS, and right lower lobe having 5 BPS, 1 apical, 4 basal. Let's draw the diagram. As you are drawing this diagram, you will find this is the front view of the right lung. And as you look at the front view of the right lung, it will have a horizontal fissure. So one more. Yeah, that is the oblique fissure. So there is the front view of the right lung. This is horizontal fissure. Yes. And this is the oblique fissure. Yes. What is bounded by the two? Bounded by the two is the right middle lobe. If you say this is the right middle lobe, then this must be the right upper lobe. Yes, that is the right upper lobe, and this is the right lower lobe. So as you see, this is the horizontal fissure, this is the oblique fissure, bounded by the two is the right middle lobe, and then this is the right upper lobe, and this is the right lower lobe. And how many BPS here? If you're talking about the BPS, then you will have 10 BPS here, 10 bronchopulmonary segments. And out of 10, how many in the right upper lobe? There are 3 of them. And how do you name the 3 of them? You will see that there is one apical BPS in the right upper lobe, and there is one anterior BPS and posterior BPS, so total 3. And how many in the middle lobe? There is one medial BPS and there is one lateral BPS, so total 2 in the right middle lobe. So right middle lobe is having 2 BPS, and which is lateral and medial BPS? Yes. And then you have 5 BPS in the right lower lobe, which are, you will see that there is 1 apical and 4 basal. And how do you name the 4 basal then? So you will find that right lower lobe has 5 BPS, 1 apical and 4 basal, and the 4 basal are named as anterior basal, posterior basal, and medial basal, and the lateral basal. So you are telling that there are 4 basals which are named as anterior basal, yes, anterior basal, posterior basal, medial basal, and lateral basal. Now, which of the 4 basal is the most dependent location, because we got a patient? So you want to know which is the most dependent location now? Yes, because you got a patient. What is a patient? My patient was in erect posture, which could have been sitting or standing posture, and he has aspirated. So in the erect posture, sitting, standing posture, somebody has aspiration pneumonitis. Yes, I want to know where is that aspiration pneumonitis. The posture is erect posture, could be sitting, standing posture, and the patient has aspirated. Where is the aspiration pneumonitis? Right lung or left lung? You see, mostly it will be right lung. Why mostly it will be right lung? Because trachea bifurcates like that. How the trachea is bifurcating like that? If you remember, we have told the trachea bifurcates such way that right principal bronchus is different from the left principal bronchus. Why? What is the difference? Actually, right principal bronchus is short length, and it is wide lumen, and it is more vertical. So it will be more chances of having foreign bodies going towards the right lung. So you're telling that there is unequal division of the trachea? Yes, that's why. Since the right principal bronchus has short length and wide lumen and more vertical, more of the foreign body is coming here. The thing is, gravity will pull it to the base. Which base? And you remember, the most dependent location in erect posture is the basal, and that basal is the posterior basal. That is where you will have the pneumonitis. You mean to say posterior basal of the right lower lobe? Yeah, that is your answer. The aspiration pneumonitis in this patient will be actually posterior basal BPS of the right lower lobe, Now understand that most of the aspiration actually occur in supine posture. Why most of the aspiration occur in supine posture? Because these are coma patient or maybe post anesthesia patient. So they are unconscious and they are aspirating. You keep them in pitch posture. See, most of the aspiration occur in supine posture. Why? Because these could be coma patient or post anesthesia recovery phase, and you keep them in which posture? They are unconscious. They can aspirate. They are in supine posture. Now the point is, if the patient was in supine posture and they are unconscious and they are aspirating, then where is the aspiration pneumonitis? And for that, we are reading some medicine books and surgery books, and they are giving us the answer as, I will give you the reference of Harrison medicine here and Schwartz surgery. But why are you giving the reference of Harrison medicine, Schwartz surgery? Because there is some controversy, that's why. So what is Harrison medicine, Schwartz surgery telling? They are telling if the patient was in supine posture and if there is aspiration, it will be at two places. What are the two places? These two places. Yeah, what are the two places? See, if it is in supine posture, the content will be here and here. Means where? It is the posterior BPS of the right upper lobe, or it is apical BPS of the right lower lobe. So two answers. Yeah, two answers. If the patient was in supine posture, the collection will be in the posterior BPS of the right upper lobe, or it is apical BPS of the right lower lobe. Now, if I have to choose between the two, which one should I choose? Because one AIMS question has already come. Both the options were given. You have to choose one answer. For that purpose, I believe that maybe it was asked by some anatomy professor, and in anatomy books it is mentioned that if it is a supine patient, then the collection usually come to the apical BPS of right lower lobe. You mean to say, if the patient was supine posture, anatomy books tell that the collection will be in the apical BPS of right lower lobe? Yes. So you are assuming that this should be first answer? Yes. But why this should be first answer? Why not that? Because I am telling you that most of the anatomy books will say this is the answer. So keep it. So what about the medicine and surgery book? Medicine and surgery book cannot help you here. Why? Because if you follow them, you'll have to answer. You cannot have to answer in a single question. Which question are you talking about? I'm talking about this question. It is asking a bedridden patient, which is usually supine. So tell me, if the patient is supine, then aspiration pneumonitis is most likely there. And now you got to answer. So which one will you prefer? You will see that this is the best possible answer. If now you say this is the best possible answer, what is that? Apical BPS of the right lower lobe. Now if you say this is the apical BPS of right lower lobe, the best answer, then what about that one? Yeah, that can also be the answer, which is posterior BPS of the right upper lobe. Posterior BPS of the right upper lobe. Actually both are answer, but C is better than A. See, if you are following Harrison medicine or Schwartz surgery, they will not help you reach the answer because they will give equal weightage to both of the options. So both of them can be the answer. But if you follow anatomy books, maybe you will get C, a better answer than A. But both are equally good, according to medicine surgery. If anatomy, then C is better than A. Okay, when is the answer choice number D? Choice number D is your answer if it was a patient in erect posture. And what is erect posture? Erect posture could be sitting or standing posture. So where will they aspirate? It will be the posterior basal of the right lower lobe. So if the patient was in erect posture, in standing posture, then will be the posterior basal of the right lower lobe. Yeah, that is the point. But this patient was bedridden and supine posture. So double answer. And C is better than A. This all is decided by practicing more and more MCQs, and you will gradually realize that some of the facts are to be followed while answering controversial questions. That's why C is a better answer than A, according to my experience. What about the left lung now? We want to look at left lung. Yeah, left lung, if you want to see, then left lung is having only one fissure, which is oblique fissure. Let us look at the left lung anterior view then. It is having only one oblique fissure, so there is no horizontal fissure, and there are two lobes. There is left upper lobe and left lower lobe. Actually, we will focus more upon the left lower lobe this time. So what do you want? What I want to focus upon is that left lower lobe is having one apical and only 3 basal. Now, why would you say that it is having only 3 basal? Why not 4 basal? Why not 4 basal? Because there is combination of the two BPS into one. And what was that? You remember there was anteromedial basal. Anteromedial basal, that is the point. So you are telling that right lung has 4 basal? Yeah. And left lung has only 3 basal? Yes. Remember, generally speaking, right lung will have 10 BPS and left will have 9. This is given by Gray's anatomy and Schwartz surgery. What is Gray's anatomy, Schwartz surgery telling? That right lung is having 10 BPS and left lung is having 9 BPS. But why the left lung is having 9 BPS? Because the anterior and medial basal, they have joined to become one anteromedial basal BPS. This is the discussion now. So we are looking at the left lung now. Yes. And you're telling 1 BPS missing. Can you tell me why 1 BPS missing in the left lung? It is understood that this is the heart which is encroaching at the base of the left lung. So it requires some space. This is the heart which was encroaching at the base of the left lung, so it required some space. That is why left lung do not have medial basal BPS. If the left lung do not have medial basal BPS, then that is why it has 1 BPS missing. And why that BPS is missing, medial basal? Medial basal is missing because it has to give space to the encroaching heart. The heart is coming from medial direction at the base of the lung, so medial basal is absent. That is the point. Let us discuss that by drawing a diagram ourselves. And when you are drawing the diagram yourself, you'll find that this is now the front view of the left lung, showing one fissure only, which is the oblique fissure. So you are telling that this is front view of the left lung showing only one fissure, which is oblique fissure. Then this must be the left upper lobe. Yeah, that is left upper lobe. And this must be the left lower lobe. Yes, that is the left lower lobe. And I want to focus upon left lower lobe, which is having 1 apical BPS and 3 basal. Yes. And we have to see that which basal is missing and why that basal is missing, because there's only 3 basal. So we said that there is this heart, and this heart is encroaching at the base of the left lung from the medial direction. And as the heart is coming from the medial direction to the base of the left lung, it needs some space to occupy. And as it is encroaching on the base of the left lung, the medial basal BPS of the left lung is missing. That medial basal BPS of the left lung is missing to provide space for the encroaching heart. And remember, medial basal is also called as the cardiac BPS, and the cardiac BPS is present only in the right lung. It is not present in the left lung. So you're telling that medial basal is missing, cardiac BPS is missing from the left lung, and it is present only on the right lung? Yes, only right lung has the cardiac BPS. Can we discuss the basal which are there in the left lung? Yes, you can. They will be called anterior basal, posterior basal, the lateral basal, but there is no medial basal. So there is anterior basal, posterior basal, lateral basal, but no medial basal? No. Then what about the anteromedial basal you were talking about? Actually, anteromedial basal is the name given to anterior basal only. So you're telling that anterior basal is also called anteromedial basal? Yes, by some books it is written like that. So anterior basal can also be called as anteromedial basal. Yes, but remember that the left lung do not have any medial basal until you are talking about what is called as dextrocardia. Why? What will happen in dextrocardia? Explain. If you're talking about the dextrocardia, then it is situs inversus. Yeah, what is happening in situs inversus? Explain. As you're talking about situs inversus, let us look at the detail. You'll find a case of dextrocardia situs inversus. This is the left lung. Yes. and that is the right lung. Yes. Since this is the dextrocardia, the heart is encroaching on the base of the right lung. So right lung do not have the middle basal or what is called as the cardiac BPS. Oh, that is what is happening in situs inversus. Yes, you see. If it's very rare, but this can be dextrocardia, situs inversus in that situation. Now the heart, this is the heart, is encroaching upon right lung, and that is left lung. So you're telling now the heart is encroaching at the base of the right lung. Yes, and that is why the right lung do not have middle basal segment to provide space for the encroaching heart now. Yes. So cardiac BPS is absent on the right lung. Yes. You mean to say right lung is having 9 BPS? Yes, it is having 9 BPS now. And the left lung is having 10 BPS. But remember, left lung having 10 BPS is very rare. Why it is rare? Because situs inversus is rare. That's why. I told you, left lung can have 8 to 10 BPS. Now it is having 10 BPS. You mean to say that left lung can have 10 BPS? Yeah, if it is a case of dextrocardia, situs inversus, then. But it is rare. Yes, it is rare. So what should I answer if somebody is asking me, how many BPS in the left lung? I told you, 9. Which book is telling 9? One is Gray's Anatomy, the other is Schwartz surgery. Can we see some diagram of Gray's Anatomy or Schwartz surgery? I'll show you. This is the diagram. What is it telling? It is telling that medial basal not present in left lung. So how many in left lung? 9. And how many in right lung? 10. Which is missing? Medial basal. This was the discussion. So medial basal is not present in left lung. This is the usual population pattern. Yeah, that's a usual population pattern.